Hi, my name is Josh Freitas with the National Institute for Dementia Education, and today is NI Talks, and I have a very special guest. Allie here is piloting some technology that really got my ears to perk, and I got to learn a lot about how we can use this technology. So I thought it was a great resource to kind of share with the whole industry. So Allie, do you mind introducing yourself, and then also tell us a little bit about your product, your technology?
Hi, I'm Allie Troutman. I'm the founder and CEO of Wicked Technologies. We've created the Wicked Smart Pad. So this is the first of its kind, a washable and reusable bed pad that detects moisture in real time and alerts caregivers of that moisture event on the dashboard of their choosing. So specifically selling right now into senior living facilities.
I have to ask though, because I'm from Boston, so the word wicked I use all the time. How did you get the name?
So my first business was actually Wicked Sheets, which was bed sheets for people with night sweats and hot flashes. And I liked the play on that they wick away moisture and then that they were wicked cool. So everyone often asks if we're from Boston, but I'm originally from St. Louis area and now in Louisville, Kentucky. But I'll play up the Boston angle all day long.
That's fantastic. Now, so what made you create this product and kind of what is the importance? Why create it?
Yeah. So actually, and ironically, my grandmother was sleeping on my first product, the Wicked Sheets, in her assisted living facility. And sadly, like many of the folks you've dealt with before, she was diagnosed with dementia, and that led to incontinence. And unfortunately, had to go to the hospital for a little stint for an acute heart issue. And while she was there, she developed a pressure injury. And one of the things, that we experienced was that we knew she was going to pass away, but we wanted her to pass away with my grandfather in her assisted living facility. So they let her go back, and her care staff said, if your sheets would just absorb more moisture, these incontinent events would, help her bed sore, her wound heal better, or her not be in so much pain. And so what does an entrepreneur granddaughter do but try to solve a problem with a product? And I created the Wicked Smart Pad for just that. My grandfather also had macular degeneration, and so he was oftentimes feeling on the bed for where she was wet and didn't know. And like most grandparents, they didn't want to trouble anybody to say, come and change the bed. So I put an alert in there that would send an alert to the caregiver to notify them that they needed to be changed because they didn't want to trouble anybody. But grandma's skin needed to be dry, and my grandfather certainly wasn't going to be able to change the bed for her. So sadly, she passed away before I got the product to market. But I feel like every time we talk to any new customer or user, it's for my grandmother. I'm like basically thinking of my grandmother the whole time.
That's awesome. And one thing I got to say is I've read some literature recently too. The amount of times we wake people up with dementia that's not needed really affects their sleep, which then cognition and falls. So being able to have that pinpoint of, okay, this person does need to, so you're actually entering the room with a purpose, I think can be really powerful. And it sounds like that's kind of what it does, is that it notifies them when they do need that need, not just randomly just for room checks.
Yeah, that's exactly it. Unnecessary waking is huge in the dementia community, particularly because it leads to, like you said, behaviors or the fall risk, or elopement. We don't want any of those things to happen, but we also don't want to wake someone when they're sound asleep because that sleep is so rehabilitative for them. So in some of our pilot studies, we've actually seen an 80% reduction in unnecessary waking with the residents that were using the pad. So we're really proud of that metric so far.
And I have to assume too that I know I don't want to make this justification or this assumption, but I'm assuming less times waking up is better quality sleep where people aren't waking up and having those falls in the night. So I don't know if there's data for that, but I'm assuming that because there's less times waking up, they're not getting out of bed as much and then possibly having those falls. So trying to mitigate some of that fall risk too.
Exactly. And one of the things that we're looking at right now with our pilot partners is the time frame in which they're going. So let's say, for instance, apartment 516 is consistently wet at 8 o'clock in the morning. Why don't we put together a toileting schedule and wake him at 6:30 or 7 to go to the restroom so that he doesn't have that moment of, oh no, it's too late, and try to get up and stand when either he's immobile and doesn't have that capability, or his walker's not nearby or gets tangled in something on the floor. So I think the fall risk and the ability to have these predictive analytics so we can implement toileting schedules are all going to help us see, reductions in the liabilities in the room.
And just the behavior change alone, like I'm a big believer in circadian rhythm, and that can help with cognition. Is what you're doing is literally creating how that body has memory. And if they're waking up every day at 4 o'clock, to be proactive about that, and that can actually be a really powerful tool to change how we care for our seniors. I do have a question for you. It seems like this is in a residential setting. Have you done any work in the home, like one-offs, or kind of just kind of see, is that kind of a future thing that you're thinking about, people living at home that they could use this?
Yeah, as you know, a lot of folks are aging in place now. So we've started some early discussions with some home healthcare agencies. That way the caregiver who's monitoring, let's say 5 or 6 patients on their load can actually be aware. And they were starting to look at that electronic visit verification. Does checking on them and making sure that someone in the home go and change their bed count towards that EVV, like now that all states are moving towards? We also, my parents live in St. Louis and eventually they will need this product as well. I would love to be able to be notified, and then I can call my brother who's their neighbor and say, Mom and Dad are wet, and go and change them. But, I do see this being, something that's applicable D2C. It's been, for us easier to start in memory care units where incontinence rates are so high. And just by nature of the progression of the disease, we're seeing incontinence rates higher, but we're also seeing increased fall risk. So we want to try to provide as much impact as we possibly could with the early research, at least.
Also, I heard that you are conducting these feasibility studies, and I wanted to kind of walk through. A lot of times we have products that we say, oh, it does this, but actually collecting that research to do larger group research. Can you kind of walk us through where you are in that phase of research?
Sure. So we were very fortunate to receive some grant funding from the National Institute on Aging, that afforded us the ability to do feasibility studies across 3 pilot locations. So one of the things we were looking at first is this a good product market fit, right? Are we reaching out to the right customer? So check the box there. But we wanted to see, can we track in real time when the spill happens? Can we also track the incontinence response rate of the care staff getting the alert and then coming and checking on the resident? One of the big things we were concerned about is, all right, is this a legal hurdle? But everybody's using an e-call system right now. So, and they're tracking the response times on e-call. So we were very fortunate to be able to, fit into that criteria of this is not a concerning thing. But now think about how powerful it is for the facilities to say, we did go in and check your mom a number of times last night, or we originally thought she was only going 2 times a night, and now we know she's going 6. So let's talk about how to adjust her care plan and get her the right coverage that she needs. And, those are the types of things in these feasibility studies that we were able to tease out. We will likely do a clinical trial where we will implement those toileting schedules and look at baseline and some early endpoints, and then, I guess secondary endpoints, if you will, of how that has changed and the fall reduction that's reduced. So, we do have some high hopes for our next clinical trial, but really feasibility of, is it product market fit? Can we track this and alert them in real time? And can we provide the analytics to say how and when they're going and changing them? And then some historical data on just their incontinence patterns. And so far, so good, thanks to our pilot partners.
Well, it's also a really great tool, I think, for trying to be proactive to prevent UTIs, not sitting in that moisture. And that's a huge issue we see in memory care is a lot of times people get UTIs because they're not cleaned quick enough over time. And also hydration, but that's a good way. Like for me, if I was to follow that data, I'd be looking at how often are they going to the bathroom? Are they getting hydrated? And are they having enough fluid intake? So I think it's a great way for that data. Where, if you don't mind sharing, where have you done like the biggest pilots, kind of a shout out? Because it sounds like it's going well. And I think it's important to give some shout outs to people that are participating in this research too, as well.
Absolutely. We are super fortunate that here in Louisville, Kentucky, Atria Senior Living is in our backyard. And so I was very lucky to early on meet their senior vice president of care. And she's a forward-thinking, innovative woman that really believes that resident care is, the gold standard. And when I talked to her about it, she said, let's get you started. So we've been partnering with Atria Senior Living as our pilot partners. We've recently added a hospice location. So this is really important for us to test the product on someone that, their lifespan is a lot shorter, and they're going to rotate the pads, use the pads on numerous residents. So this is really great data. And then another nonprofit called Mercy McMahon Terrace out in Sacramento. another just incredibly innovative executive director of the building that always puts care first. So Karen Devaney has helped us. She is my partner at Atria, and she's done every pilot install. She will lift mattresses and change pads and, help us with all the clinical insights. So we've been so lucky to have her on board as part of our clinical advisory team.
And kudos, I've worked with Karen in the past, and I love Karen too as well. She's hands-on, she gets it, she thinks global, but she's also a big pusher for stuff too as well. If you were to kind of predict the future in the next 2-3 years of how this innovative technology can make an impact, what do you see it helping with? I see global change, but I'm curious of your opinion. I know that you have a mission too. What do you kind of see in the next 3 to 5 years with this type of technology?
Yeah, I think it's just the timing is right because now a lot of these senior living facilities or communities are not afraid of innovation. They're not afraid of using technology. And that used to be so passé. They were like, it's care, it's hands-on, it's touch. But now they're totally comfortable and accepting and actually like you said, forward thinking with what can this data help me do for my resident? And so I see this great shift of technology is not a scary thing anymore. It is going to become our best friend and it's going to be able to help care providers provide better care. I don't want to say it's going to necessarily become a better standard of care because incontinence has been around for 1,000,000 years, right? And we just know we have more data that we can predict UTIs. We can help with skin breakdown. We can decrease fall risks. And I think people are over the next year going to really embrace that. And I think families are going to feel like the community that they put their loved one in is reacting and being proactive rather, with the innovative technologies they're incorporating in their buildings. So I think we're going to see a really big shift of just accepting technology on the whole, whether it's incontinence related or not.
And I got to say, for any operators that are listening to this, I think it's a great opportunity. I hear conversations all the time that we're struggling with staffing to get people into these buildings. Is this precision health can actually allow us to allocate the right time so that maybe if you are short on the floor or you don't have somebody call in, it allows you to actually cater to the need points versus just checking randomly. So it actually could help. And even profit margins in our industry is getting different, is that this is a good way for us to look at that as how do we be more efficient in our care? And I think that this is a great product to help with that efficiency too.
Well, thanks. And if you don't mind, I'll share an anecdote of an exact use case when that happened. We were tracking in one of our pilot locations, incontinence response rates, obviously, and one of them just so happened to fall over Christmas time. Well, you can imagine the no call, no show rate of staff sometimes happens, particularly around holidays. And we saw a spike in incontinence response rate from the care staff. And once we did the drill down on who was on shift that night, how many people were in the building, we saw that the response rate was increased because they had a no call, no show. They intended to have 4 people on staff. They only had 3. And that the spills were isolated on one side of the building when another spill happened over here. So had they been staffed appropriately or efficiently, they could have, decreased the response time, but they would have been able to cover more ground in a more efficient way. And so we've seen this firsthand. And then we provided this floor plan view so that the actual nurse at the nurse's station who's telling the staff where to go can see exactly on the floor in their floor plan at their building, who's wet and who's dry, so they can plan to divide and conquer basically. So I love it. And I love that we were able to see that. Of course, the operator's like, oh my gosh, I'm so embarrassed. I'm like, this is perfect learning. That's why you do pilots. And hopefully we can help build that out so you guys know how to staff more efficiently or better. And like you said, it's all about bottom lines to the operators and the owners of the buildings most commonly. So,
and it also brings up that point too, and I feel like hopefully I don't offend anybody, but I'm going to say it anyways, is that a lot of times we don't know how to charge for incontinence packages. So it's kind of like, oh, it's an incontinence package, but this actually allows you to look at that data and say, this is how much they're going, and these are the reasons, and you can really know when that is, or scale up or scale down. It allows you to have that flexibility in real time versus just a stab in the dark. Because I'm sure that the trends too, for like looking at people's patterns, it can be, it's really fast. For me, as being a researcher, my mind starts going off because there's 100 different types of dementia, and I'm wondering, is there any patterns that come into that of sleep? People, Lewy body Audie and Parkinson's don't sleep as well. So this pad could actually collect some data of some of their sleep cycle too as well. Now, do you think it will ever branch beyond just the kind of the incontinence section? It sounds like for falls and other things, is there anything else innovative that you feel like you could share that you're kind of looking at or thinking of tweaking or trying to pilot?
Yeah, well, you hit the nail on the head. We're very interested in sleep, particularly as you mentioned in this population, knowing how vital it is for them to be asleep and use sleep as rehabilitative for their conditions or diagnoses. So important. So we are doing some early pilot studies on monitoring sleep, and we're very excited about the results we've seen so far. So more to come on that. But the other big component is the accessibility and the mobility of the pad, because sometimes for those that are immobile, you're going from a bed to a wheelchair. And so we have worked on some new exciting ways to be connected and to be mobile with no cords, no plugs. That way we can continue monitoring their incontinence throughout the day. Particularly like my grandmother, she would have those disposable chucks on every setting in her room, and they would end up wadded up underneath the bottom. They would end up on the floor. She would put them in the trash and pour perfume on them because she was embarrassed by the smell. And I'm thinking, we've got to have a better way. So working on the portability of the pad so that it's on the surfaces that they are moving to, that's going to be another one of our major focuses coming up soon.
And that's where I feel like innovation is exciting. Like I can see it on your face. I can see it as we talk through is this is the stuff that I think our industry really does need, is to be thinking out of the box. For you, if people wanted to get more involved or get to know more, how would they contact you to help you grow? Or if they wanted to do a pilot, how do they get in touch with you?
Yeah, thank you so much for asking. So on our website, it's wickedsmartpad.com. You can go to the wickedsmartpad.com website and fill out the contact us form, and that goes directly to me. I would reach out personally to you. Founder-led sales is the way to be when you first start, because I am the voice of the customer right now. So it's really important for me to have these interactions. And we also, thanks to the grants from the NIH and the NIA, we do offer a 2-week free pilot for up to 5 beds in your residence. We come in, we do the installation, we do the nurse training or care staff training. We're working towards getting that to count as a CME. So we're working with another agency that will allow us to do some incontinence training and it count towards your CME credits. And so we want to offer that to any of your listeners. We'd love to get in touch with you and just help you understand a little bit more about your residents and their incontinence patterns, and then how to staff it more appropriately.
That's fantastic. Do you have any blogs or any Facebook pages that people should follow for updates and information?
Yeah, we actually we're most active on our LinkedIn page, and that's under Wicked Technologies. So Wicked Technologies on LinkedIn is the best place to find us, or you can find me directly, Allie Troutman, on LinkedIn. We post, company updates, exciting news from the pilots. We have a pilot wall. So if you join our pilot, we're going to take a silly picture in front of your building and put it on our website. But it's just a way to pay homage to the folks that are like really thinking innovatively about how to care for their residents. And they love it. The residents love when we come in. We have this very tall, handsome sales guy that comes with me, and all the women residents scoot their walkers up and they're like, "What are you doing here?" And it is like, we try to have fun, because at the end of the day, when we come in and say we're here to talk about incontinence, they're like, "Not me." And I'm like, everybody pees.
And I think it's to normalize those things too is really important. One aspect that keeps popping in my mind, are you familiar with lifestyle medicine foundations? So there's different branches of lifestyle. One of those foundations is actually sleep, and there's a lot of literature out there is in sleep, they call it sleep hygiene, but there's a lot of assessment tools you might want to look at. And it's a national organization for lifestyle medicine. But I think that your product could be a great way for people to prescribe a non-pharmacological intervention and actually be part of that lifestyle medicine model. And that sleep is a big part of that. So and restorative sleep. So I think that might be a good place for you to look just in general. So
I love that. Thank you so much. I'll take all the research and all of the tips, because honestly, somebody said to me, this business is relational. And it really is, because you need to listen to the experts that have lived and breathed this before, so you can learn and shorten your learning curve, particularly for folks that are founders like myself. Customer discovery is a real part of my business, but if you talk to someone that knows or has lived it, you can make less mistakes. You can get on beds faster. You can impact lives a lot faster. And so I appreciate any of the feedback that you'll give me or any of your listeners will share with us.
That's awesome. Now, for closing, Allie, anything you want to kind of share with anyone listening, or anything in particular?
Just a huge thanks to you, Dr. Josh, for having me. I know I'm going to see you at Argentum, so I'm really excited about that and hearing your talk. Thanks to you, thanks to our pilot partners, and honestly, the National Institute on Aging has had this incredibly generous grant for folks like myself who are looking to innovate in the Alzheimer's dementia and related dementia space. And it's been a great partnership. They have made a ton of introductions, but allowed us to, really get our product out there. So, and of course, I love my team of innovators. Sometimes they're a little too fast for me. And I'm a risk taker. So it's great. You want to be on an excitable and innovative team. So thanks for having me today.
I can't say thank you enough for really bringing some advancements into technology. It's an exciting time for our whole industry to kind of see how technology is moving in. So thank you. If anyone's going to be at our Argentum, please come up to Allie, introduce yourself, follow the pages. My name's Josh, and I thank you for listening. And this is the National Institute for Dementia Education's NIDE Talk. Thank you.